I'm blessed to be able to teach both in the theory portion of our course and also in the clinical setting. So I teach psychiatric mental health nursing. Primarily, I'm in the clinical setting. When I talk about clinical, I am meaning that we are in a hospital setting, usually 3 days a week with students. So we're doing hands-on learning. So it really is experiential learning at its finest. Some of the things that I deal with students coming into this new clinical area is their anxiety. People have a lot of anxiety in coming into a psychiatric mental health arena. So I think that my students will probably say about me that I'm very kind, I'm firm in my expectations, but that I am very skilled at lowering their anxiety. So I spend a lot of time, the first several weeks of class, just teaching them how to deal with their anxiety, how to adapt to stressful situations. So we do that through role-playing, a lot of role-playing, a lot of videotaping, a lot of journaling. One of the things that I like to do at the clinical setting too, and I think this gives the students a sense of autonomy, is they are able to be a part of assigning patients. So we have the luxury in the morning of meeting with the clinical team or the collaborative team, listening to report, making clinical rounds, and then I let the students choose a patient. So maybe they want to really work on developing their assessment skills, or I'm uncomfortable assessing for suicidal thoughts. Is there a patient that might be good for me to work with, or is there a patient that would benefit from having a student? So we really take this collaborative approach, and in doing that, the students start to realize that, it takes a village. It's not just the nurses, it's a collaborative team. One of the things that I do at clinical that I think is so very important is have a clinical post-conference. Usually there's 8 to 10 students in my clinical group. So we have a private, confidential meeting at the end of the day, and I call it, let's check our bags at the door before we leave. So what we do is we do a round robin, and each student will talk about a patient they worked with, what they did that was wonderful, what they were uncomfortable with, what they would have liked to have done differently. So we go around, and after each student has shared, then as a group we jump in and talk about those difficult encounters so we can prepare ourselves next week as a group. Well, let's try this next time. And I guess the beauty of that is that I learn right along with the students. So it is not me telling them how to be wonderful nurses. It's all of us learning together. And I really like to incorporate the arts, liberal arts, into my teaching because I have found that that has been such a big part of my life. And I really view nursing as a creative process. Other things we do, lots of videotaping. Students do what I call live simulation, so they videotape with themselves being a patient and then their buddy being the nurse, and then we watch those as a group, critique them, share. It gives students a really good opportunity to see how other people perceive them when they're interacting, and it really helps to build confidence. I really want my students to understand that psychiatric nursing is a part of all nursing. It's not just this little entity that, I'm doing my psychiatric nursing rotation now and next semester I'll do my OB rotation. It's a part of every aspect of nursing. Every day of their life they will use psychiatric skills or concepts that we've learned in class. So I really reinforce that. All nurses are psych nurses, they just don't know it.